Bullock is expected to address Montana. He is now about to. He's going to outline protocols to increase Montana's testing capacity.
And commitment to keep Montana both healthy and safe over these last few days. It's so important that as we gradually reopen facets of our state, that we think about our neighbors with every single action that we take, no matter how small that might seem. I'd also like to take the opportunity to thank our frontline healthcare workers, our nurses, doctors, our hospital staff, as well as our experts at the state lab, our state epidemiologists, and local public health experts. Due to the round-the-clock work of our healthcare workers and Montana's collective actions, we have suppressed the virus in Montana. Throughout our response to this crisis, our state public health lab has been able to meet the demand in performing the tests it receives with a quick turnaround time. This has allowed the state to work with local public health to isolate positive cases and conduct the follow-up work to quarantine individuals in contact with positive cases, or in other words, to contact trace along the way. Montana is certainly one big town, or one small town with a long main street in many respects. This commitment to public health, coupled with the ability to closely follow the spread and mitigate the spread of the virus, has led us to where we are today. Of a total of 451 confirmed cases, 356 of those have recovered. This week so far, Montana has added 5 new cases. We had 0 new cases yesterday out of 337 people tested. But as Montana enters phase 1 of gradual reopening, our work certainly is not done. Among our core preparedness responsibilities in the reopening the Big Sky Plan is ensuring our ability to test symptomatic people for COVID-19 and trace contacts of COVID-positive results, which we have been doing effectively. Additionally, the plan calls for ensuring sentinel sites are screening for asymptomatic cases, and the contacts for COVID-positive results are traced, with sites focused on at-risk communities. As we enter phase 1 and the possibility for additional transmission, we are committed to further ramping up our testing capacity in the state. Today, I'll briefly outline my testing framework for Montana, our testing framework for Montana. First and foremost, we'll be establishing a testing target of 60,000 tests per month. This is a long-term goal that we'll be ramping up to get to, and we'll continue to be working with in the coming months in our continued response to this global pandemic. Federal government has committed to the states that it will supply 12.7 million swabs in the month of May alone, and continue to ramp up their capacity as well. The provision of these testing supplies for Montana will be secured through both public and private partnerships among the federal government, states, and private labs. My team and I will be working every day in the coming months to obtain the supplies necessary to reach our target. Last week, we were able to secure 5,000 swabs from FEMA. Thus far, this week, we've gotten 10,000 swabs from FEMA, with another 7,000 expected to arrive today or tomorrow. Additionally, we received 3,000 swabs from private supply chains. We'll continue to work toward a consistent supply chain of swabs and other testing materials such as reagents, and our ability to actually reach those testing targets that I'm setting out is certainly based on the availability of testing supplies. While we work to reach that long-term testing target, there are additional steps we will be taking. In the short term, we'll be implementing and proposing the following testing protocols, scaled based on the availability of swabs and in this order of priority. First, we're continuing to ask providers to test anyone with one or more symptoms of COVID-19. This includes CDC's recently expanded list of symptoms: chills, repeated shaking with chills, muscle pain, headache, sore throat, and a new loss of taste or smell. Previous symptoms included cough and shortness of breath. If any Montanan has one or more of these symptoms, I'm asking you to get tested, and I'm asking providers to do that test. Second, beginning next week, we will begin testing all residents that are willing and all employees in our nursing homes and assisted living facilities throughout this next month. Thereafter, enhanced surveillance will be conducted at these facilities. Third, beginning next month, we'll begin to conduct enhanced surveillance testing in Montana's tribal communities. Now, what surveillance testing mean? It means testing the right samples of a population in order to try to get the information that we need. Because the best way for us to keep the virus contained in Montana, in addition to continuing social distancing, is upping that testing surveillance so we can better understand if or how the virus is in our communities. And finally, as testing becomes more widely available, we'll be partnering with our community health centers for testing frontline workers and conducting general population surveillance testing as well. With enhanced surveillance, our goal is to take a sample of the represented population in certain communities to get an estimate of what could be happening with the virus. There are a lot of questions about asymptomatic spread, not just in Montana, but all across the country. So asymptomatic spread would be the spreading of this virus even though someone's not showing the symptoms. Public health experts feel that the amount of spread is currently low in Montana, and that's due to a number of different indicators. We do have few cases, and the numbers that come back positive after tests have been in total around 3 to 4% of all of those that we've tested, below the national average. Additionally, hospital rates have gone down, and we are the lowest per capita in the nation when it comes to hospitalizations. However, we want to take our testing further to conduct additional evaluations. As we engage in surveillance testing among vulnerable populations, we've also established 5 strike teams to help in the event that we do have positive tests. Each team is made up of a certified nurse and 5 National Guard members who can be sent all across Montana. Beginning next week, the teams will be available to provide assistance to nursing homes, long-term care facilities, and tribal communities in the event of a COVID-19 positive test. These strike teams will also be available to provide training and assistance with proper infectious disease control protocols to any facility that requests it. Furthermore, using CARES Act dollars, be establishing a $5 million grant program for local public health offices. These dollars can be used by any local public health office, tribal public health, and urban Indian clinics to help establish enhanced COVID-19 contact tracing programs. The dollars can be used by public health officials in their work with local businesses to develop plans to reopen that follow the necessary physical distancing protocols, or to increase education and enforcement activities, as well as any additional efforts that need to be done with contact tracing. Medical professionals and healthcare experts are certainly estimating it could still be a good long while before we're looking at a vaccine, and a vaccine that's out in any sort of mass amount. That means that this virus is and will continue to be in Montana for the foreseeable future. That means that Montanans and our frontline healthcare workers will continue to battle this virus, as will each of us, as we try to contain any spread. As we continue to do our part at the state and in working with the federal government to ensure that healthcare workers have the resources that they need, and that we continue to ramp up our testing capabilities, Montanans, of course, must continue to do their part as well. Montanans in every corner of our state are counting on one another to continue acting responsibly to protect each other. As Montanans begin to make their way back to socially distanced church services, as businesses begin to reopen their doors, as Montanans might enjoy a locally brewed backyard beer with a friend or neighbor, we must continue to treat the virus with the vigilance that we have up until now. Because the more protective actions that Montanans take now and in the coming weeks, the more likely that we're going to keep that curve flat. The more likely that we can deploy resources to where they're needed to conduct enhanced surveillance testing. In addition to washing hands, maintaining social distance, and sanitizing, strongly encourage Montanans to wear a non-medical face covering when in public, especially in places like grocery stores or other places where social distancing isn't practical. It's with these simple precautions during phase one that we can certainly protect our neighbors. As we create and begin to navigate what this all looks like going forward together, we must remain flexible, vigilant, and patient, as life will still be much different than it was before this virus. Now open up for questions. If you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. First phone question.
Hi, Governor Bullock. This is Marisa Georgia with NBC Montana. And I'm wondering, in addition to the 60,000 COVID tests as a target, is there any plan to include antibody testing, or do you see value in that?
You know what I might do, and thanks for the question, Maritza. The question was, in addition to a target of 60,000 tests a month at this point, what's our view and what's our thoughts on antibody testing? I might have the state medical officer, Dr. Holzman, say a few words.
Thank you. Yeah, the antibody testing is something that I think we're all very excited about and seeing where that moves forward. The antibody testing is very useful. The concept of it is to understand if somebody has had the virus in the past and thus has made antibodies and hopefully has some protection from getting the virus again, or if they did get the virus, to have less symptoms or less severe case. Right now, there's a lot of companies that are coming forward with antibody testing. We are looking at what's coming out and paying attention to that. We feel more comfortable once we know that there's an antibody testing that's out there that doesn't have cross-reactivity, meaning it does not is not getting false readings. So we can feel more confident about the results. And two, we're still learning more about what kind of immunity somebody may or may not have after being infected by the virus. This virus, as you know, we're learning more and more every day. And so we're watching that new testing modality very closely and look forward to using it once we feel confident that it's a useful test.
Thanks, Dr. Holzman. Another phone question.
Hi, this is Nikki Willett from Yellowstone Public Radio. Thanks so much for holding this press call. Can you talk a bit about what that 60,000 tests a month target, what is that number based on? How did you pick it? And how long do you think it will take for us to reach that goal?
Yeah, so the question was the 60,000 number, what's it based on? How long will it take to reach that goal? And I think it's by and large, it's in line with what other states and public health officials recommend as we reopen and ensure that we continue to understand where the virus is as we gradually reopen. Been working on, and to make clear too, that when we say conducting 60,000 tests a month, like if we go out and in the first month are successful in testing all of our Montanans in nursing homes and assisted living facilities. That doesn't mean you're all done and they have nothing to worry about with nursing homes and assisted living facilities and their employees. Then we would want to get into more of a sentinel or surveillance testing of those places, a more limited numbers going forward. So 60,000 tests won't necessarily equate to 60,000 individuals. And given the fact that I think I didn't look at today's site, all throughout this, the state public health labs were probably up to under 15,000 through this whole pandemic. That's a stretch goal. That's a tall order that I'm asking us to get to. But as we work on and assuming that we have supplies, assuming that the federal government has suggested that they will support the state's testing plan, something that I want to get up to sooner, not later. I know that that's not directly to your question, Nikki, of that, yeah, I'd like to see 15,000 a week. Do I think that'll happen next week as we start ramping up? Absolutely not. But that's the goal, and we'll get there as soon as we can. Another phone question.
Hey, Governor, this is Holly. I'm wondering a little bit more if you could expand on your priority for the 60,000 tests. It's like you're focusing on nursing homes and those populations first, that you sort of set the priority to start with. But as we move forward, are you looking at trying to target other at-risk people who might not be in healthcare facilities, or I guess I just wonder how that will be prioritized.
Sure.
And also wondering, you know, the committee that's working on the CARES Act funding, where they're at in their process right now.
So 2 questions, one of which is with the 60,000 tests, how are you looking at those numbers? Meaning, and who are you prioritizing? And is that fair, Holly?
I mean, it seems like you're saying that, you know, going to nursing homes and those places, that'll be the prior start with those populations get tested. Sort of who are you looking to focus on next?
Yeah, and first and foremost, I mean, anyone that has any symptoms of COVID-19, asking that they actually get tested and make sure that you do so. And while you're waiting for the results, I mean, the same things that we've been asking all along is to quarantine and still take those precautions. And in addition then, as we look at both all of our nursing homes and assisted living facilities, because we also recognize, and I know that even as we put in enhanced restrictions on visitation for nursing homes and assisted living facilities, both with their employees and the residents, that is one of the areas where you can see the most significant clusters when it comes to both people living in a congregated area and then the more vulnerable populations. Tribal nations then working to amp up within our Indian nations and our urban Indian centers have had many discussions with our tribal leaders, and rightfully so, that there's real concern because there's often multi-generational living, and there are tribal members that have health challenges and compromises that could make them more vulnerable to COVID-19. Beyond those areas too, then we want to get to the point of, we'll do additional surveillance testing enhanced surveillance testing in areas of confinement like our state confinement facilities, from Warm Springs to the men's and women's prisons as well. And then where we want to get, now recognizing all of those categories along the way, it's not like you test once. You'll be doing recurring and differing populations at times, but the sort of longer term goal of this is to get so that our community health centers, which are, you know, great facilities and stretched out, in dang near every corner of our state can both do surveillance testing of parts of their population, their clients, as well as then open it up to sort of all frontline workers that, so that they could go to community health center and be tested as well. And the second question was, so we received $1.25 billion within the CARES Act. I don't know, 3 or 4 weeks ago is when the act was passed. Not until even Friday, this past Friday, did we get any guidance from the federal government as far as how that money could be spent. But it asked both individuals in the business world and nonprofit and representatives of cities and counties to do some work over the last couple of weeks to say what are, from their perspectives at least, for the money that won't be spent as it relates to government, what's the best way to actually utilize that money? I think that their hope is to have at least guidelines of some proposals and recommendations by this Friday. I haven't been on any of those calls since the first one, though.
Thank you.
Yes, ma'am. Another phone question.
Hi, this is Terrence. I'm from the Bullock Daily Chronicle. I was hoping you could talk a little bit about the state's capacity for contract tracing and kind of what you guys are looking at in terms of expanding contract tracing in counties.
Sure. So the question was the state's capacity for contact tracing and what we're looking at going forward. And to be candid, and that's the way that we've gotten to this point in part, as well as all Montanans taking this all responsibly, is that it's not necessarily the state's the state's capacity for contact tracing. It happens at the local level, and it happens through our local public health, who have been doing that work all along. And what we want to do is provide support for them along the way. Support for them if there's a time where they are overwhelmed based on the staffing that they have, that we can provide assistance from the state level with our epidemiologists to reach out to help on the contact tracing. The support of taking the $5 million of the CARES Act and saying that local public health, as they need to augment that, and others can apply for grants from the state to do so. Because as we get into this next sort of time of this disease, right, what we're really trying to do, just like local public health had been doing all along, every time you get a positive, you want to minimize the ability of that COVID-19 positive person to spread it to others. And it really is the contact tracing and testing that will assist in doing so. So I've been, so pleased with the work of local public health all across the state to date. And what we want to do is make sure, because we really do have to be aggressively contact tracing, make sure that if there are any holes or gaps or any ways that we can provide assistance at the state level, that we'll be doing so. Another.
So I'm going to do all of the 2 questions. The first one, a follow-up on Karen's question there. So about contact tracing capacity. Yesterday, NPR published a story citing experts who said the state should have about 30 people doing contact tracing for 100,000 residents. According to information DPHHS provided, we have about 130 people between state and localities here, which works out to about 12 per 100,000, if I've done my math right at least. So given that, do you find that do we need more staff there? And then secondly, I wanted to ask about the expand testing, whether you'd be collecting more information about where that's being done.
The first question from Eric was, well, do we have enough staff? There was an NPR story. And recognize to Eric and others that states, as they now talk about they will be contact tracing, many of them didn't have the capability and the capacity that we've had through this pandemic so far to actually make sure that of the 436 cases or 450, that those efforts have been occurring all along. And part of the idea of these CARES Act dollars, part of the regular communication is that to ensure that they do have what's needed. You know, when you're in like 5 positive cases this week across the state, you're in a little bit different place than what many of our states are, and that's a credit to all Montanans. So I do think that we have the capacity there, and to the extent that there are challenges and constraints, that's also why we work together as a state and say how best to handle those constraints. And the question of whether there'll be additional information coming out as far as where those tests are occurring and what, we'll certainly look at what we can do and provide. Another phone question.
Hi, Governor. It's Matt Bowles from the AP. Can you hear me?
Sure can, Matt.
As of today, at least 60 school districts so far have said no thanks to reopening May 7th. Have you had any second thoughts about providing that option?
Have I had any, I missed that question, Matt?
Have you heard of any schools that actually plan to reopen on May 7th? And have you had any second thoughts about giving them that option?
So the question was if there's, I don't know, I think you said 60 schools that have so far turned around and said they're not going to reopen for the rest of the school year. Have you had communications with some that may be considering reopening, and have you had any second thoughts about giving them that option? To the point that, look, I, in that first directive, took away local control from local districts, and in returning it to them, I'm counting on those local districts to do the best that they can to take care of the students as well as the overall building and make sure that education can still go forward. So we'll support any district, whether they decide to close for the rest of the year or reopen in some partial or limited capacity. And so certainly don't have any second thoughts on providing that. And our public health team is more than willing to work with any local district that makes that determination that that's best for their community. Next question.
Hi, this is Vicki from YPR again. I'm curious if the Montana National Guard is still checking temperatures at certain airports and train stations, and then how does the state plan to notify incoming tourists, and especially people who are driving into the state, about the required 2-week quarantine? And are you, like, what kind of help are you offering to local jurisdictions and tourism hotspots to help manage that potential incoming risk?
Yeah, so the question was, is the National Guard still testing at airports and train stations? And are you going to help local governments as they work with this, as we still have, and to be clear, right, we still have a 14-day mandatory quarantine for travelers coming to Montana for non-business related purposes. And yes, the answer is that we are, National Guard still is doing temperature checks and providing information right now at our major airports and our train stations. I believe we still have reader boards that the Department of Transportation put out on highways of entering into Montana. And as we go forward, you know, we'll work with local communities and jurisdictions, but it's also, all of these are enforceable at the local level. All of these, just like it's been for the last 45 days, how any of the directives we put out work relies on our friends and our neighbors and everyone taking this serious more than law enforcement. And I recognize that Montana is the greatest place in the world to be it's 80 degrees in Helena today. But at this point, we're still keeping the quarantine order in place, and we'll assess that along the way. And we're asking people that might be visiting Montana to take that seriously. Yes, sir, John.
Governor John Riley, Montana Television Network. Just a quick follow-up with that. Would this increase in testing lead to a potential for lifting that quarantine for out-of-state travelers?
Yeah, so John's question was, would the additional testing lead to a potential so that we're no longer quarantining out-of-state travelers? Like each of these, and hopefully I made clear last week I guess a week ago today, when we sort of rolled out the phased plan, that none of this is written in stone, right? Meaning that we have to assess what's happening on the ground along the way. And that's for places that we might be able to advance, as well as any setbacks that might occur. The better understanding, of course, that we have of the virus, the better it informs us what we can collectively do to take steps going forward. So there's not the direct correlation. You test, get up to 60,000 a month, so then we can open things up or switch to phase X, but it helps us inform any decisions that we make along the way.
And then just a quick follow-up, sir. I know it's a $3 billion industry, tourism in Montana, and right now is prime time for people to come visiting. Is there anything being looked at to help those businesses that depend on that, and quite frankly our economy that depends on it?
So the question was that tourism is a very significant business in Montana, and now is the perfect time to come to Montana. Is there anything that's been being looked at to help those businesses? I'd only take issue that any time in Montana is a wonderful time to visit, and that's why, you know, we get 13 million visitors each and every year. And I know that there's behaviors change, not just in Montana, but around the country as we deal with COVID-19. As but one example, had a discussion with the tribal councils and tribal chairs earlier today, and tribal governments are still keeping the stay-at-home order in place, and I have great respect for that as well. We have to do what's best for our communities, but they, as one example, have real concerns about all the folks from out of state or folks that might look at our numbers and say Montana is the best place to be during a global pandemic. So we have to take measured approaches as we open up Montana for tourism. Directly the question of, as you look at these businesses that are being significantly hard hit, is there any discussion of what might be able to be done to mitigate that, in addition to what the federal programs have done with the Paycheck Protection Program and others, I assume that you're talking about. And I think that that's one of the areas and kind of a carve out that the advisory group has been looking at.
Another phone question.
Another phone question.
Yeah, hi, Governor Bullock. It's Maritza from NBC Montana.
Hi, Maritza.
We're already hearing warnings in Bullock County about this flooding season. I'm wondering what our state response looks like in the age of coronavirus.
Yeah, Maritza, I'll get back to you on that. I mean, to be honest, that from the perspective of that, you know, for the last 45 days, I've, whether I like it or not, I think ate, drank, and slept the COVID-19 challenges that we've been having. And, you know, the base infrastructure that we always have for fires, floods, and hurricanes, and everything else of working with our local disaster emergency services partners are still in place. Now our DES offices, like everyone else, are that much more strained because of what's happened over the last 45 days. But haven't gotten a report, at least recently, of sort of the flooding conditions, the potential for it. We'll be preparing for that, just as I know that the Department of Natural Resources and Conservation, as an example, are already taking the steps of what they may need to try to prepare us for fire season. Final phone question.
Governor Bullock, this is Karen Stein from the Wilson Daily Chronicle again. I was wondering if you have any more of a sense of what thresholds would be needed to be met to reach phase 2, or if there's any sort of timeline for that at this point.
Yeah, and so Karen's question was any better sense of what thresholds will be needed for phase 2 and the timelines. And recognize we're 2.5 days into phase 1. And what we need to do, and there's even, I mean, there'll be gradual reopenings happening next week that didn't start on Monday. So again, what we'll do is assess what the virus is doing, how people are behaving, do we have the medical capacity that we need, and do a data-informed decision. But there's no way to say it'll happen on X day until we actually see what happens over these next 2 weeks, because it's today's transmission that may well end up showing up anywhere from 6 to 14 days from now. So we're always, to a certain degree, looking backwards. You guys got everything you need? Again, we'll thank you very much. We'll continue to try to keep folks updated and still encourage Montanans to treat every community member as a family member. And thanks for the patience through the trying times. And as we gradually reopen facets of our economy, I'm excited that Montanans will continue to take this seriously. And we'll also keep you updated as we work on these enhanced testing all throughout our state. Thanks so much.
Governor Steve Bullock addressing the state just one day after President Trump said the U.S. would soon be conducting up to 5 million COVID-19 tests a day, something that medical experts say would be necessary to open up the country safely. Now, currently, the U.S. is conducting about 200,000 tests a day. Governor Bullock says here are the steps Montana will take with increased testing. First, he will ask providers to test any patients with any one or more of the symptoms for COVID-19. That also includes additional symptoms that were just released by the CDC. We will then move to enhanced surveillance testing of assisted living facilities and nursing homes. From there, enhanced surveillance testing on Montana's tribal nations. And as more tests are available, we will be testing frontline workers and the general population.